All right, so I'm going to get started with the slides. This session is for supportive living. If you're just joining, we just went through blended case management, and this is what this session will focus on. I'm going to start with my presentation, and then we're going to do a panel presentation. All right, so supporting living programs, what is available? You have a lot of different options here in Chester County. One of the options is a Max Care residential program, which is 24/7 staffing and can be really helpful for people who need a lot of support. And that is a house-based or apartment-based system. Typically, if you're in house-based, you're going to have several roommates, and it can really help with learning some of those social settings and working on that type of skill. Then you have a mod care community residential rehab, which is 16-hour staffing. That is typically apartment-based. Then there is residential rehab, forensic programming, which is for people who are being discharged from jail, and Liberty House and specialty regional programming. Next slide. There's also a function of supportive living called set-aside units. There are not very many of these, but I thought it would be helpful to understand the different types of independent living situations people have. So this is the most independent living situation you can have within the supportive living program. They are mental health units that are set aside by developers asking for county money. The tenants will pay 30% of income plus utilities. And this is the only supportive living service where they're not required to engage with services. Usually, if you're in any supportive living program, you have to have some demonstrated mental health treatment. And within this, there are voluntary mobile services to support independent living, especially if you feel like you need extra help, but you don't have to engage in the same way as the other programs. Keep going. Now, what's offered through supportive living? They can help with med management, hygiene, social relationships is a big one, especially if you're living in a roommate type situation and you're having to navigate using the kitchen at the same time, having rules around the house, things along those lines. And they can help with transport navigation. They can offer employment assistance and even budgeting. Next slide. So who qualifies? For anyone who wasn't in the other session, for all of these services, you need to be 18 plus. Supportive living is for adults within the Chester County mental health system. You also need something called a serious and persistent mental illness diagnosis, which is really a clinical term for someone who is having mental health symptoms that are greatly impairing their ability to have quality of life and do the things that they want to. So maybe it's hard to take care of yourself, hard to maintain employment, things like that. And it has to be persistent. So this has to be recurring throughout your life. And you also must be a resident of Chester County, especially with supportive living. These programs vary so much depending on the county. So this is only going to be specific to here. You also must be a single adult, and you also must be actively engaged in mental health treatment. So supportive living is only going to be one part of your outpatient services. Next slide. So when you do apply for supportive living, just to give you an understanding of the process, there is a committee that will review your application, and there are representatives from a number of different departments and services within Chester County. So you have representatives from Community Care Behavioral Health, which is the Medicaid plan for Chester County. You have representatives from the Department of Drug and Alcohol, the Department of Human Services, and Holcomb Behavioral Health, which is one of the supportive living providers. And the importance of having all of these different people on the panel is that they are offering really different perspectives and understanding of what's going to be a good fit for the applicants. Next slide. Now, for the application, what to include, you will need a psychological evaluation with that diagnosis of serious and persistent mental illness. That psychological evaluation has to have been within the last 12 months. You will also need a physical within 6 months. You will need a psychosocial assessment and a skills assessment. And that is assessing things like self care and money management. And in my interviews for this project, it was really stressed to me that supportive living is helping you build those life skills. So you need to demonstrate that that is what this program is going to provide for you. And it's not simply a housing situation. And also, if the application is not fully filled out with corresponding attachments, it will delay review from the committee. So we talked about in the earlier session how helpful it can be to get connected to blended case management first. This is a prime example of how they can be very useful in helping you put together all these documents, making sure that you're not missing anything. Next slide. For application processing, it's probably not going to be an incredibly quick process, just to give people an understanding of that. Applications and evaluations are returned to the mental health housing coordinator, which is Brandon Ben, who will be on our panel later to review completeness. And the committee reviews applications every 2 weeks. After they've reviewed the application, they will make a recommendation. If they think the individual is a good fit for one of their programs, they will refer them to an open bed. There aren't always open beds, so if there are not, the individual will be added to a wait list. And if they don't feel like they're a great fit for supportive living, they'll recommend another service or alternatives that will help the individual meet their goals. Next slide. So what to know? What are the most frequently asked questions about supportive living? This is really important. Supportive living is not supportive housing. This is a life skills program. It's not a housing first model, and it's not a substitute for affordable housing. This program really wants to work with you on developing a lot of those psychosocial skills, things like budgeting, things like maybe getting groceries, cooking for yourself. And it's taking place within a housing model, but the life skills are prioritized. There is also an appeal process. Maybe your first round of applying, you were not approved for supportive living. Maybe later you have some things that you think would be helpful to have the program for. You can always appeal. It's not case management. There are supports, but it's always going to be more helpful to be connected to case management as well when you're in this program. And there is no official time limit, but the typical stay is around 2.5 to 3 years. It's also not insurance-based or funded. Participants sign a room and board agreement and around 40% of income based on state room and board calculation. All right, next slide. So a little bit more background. There's about 200 beds for the supportive living program. That may seem like a lot, but it's not a huge amount. So there are going to be wait lists involved. Also, I mentioned this in the blended case management session. While you can apply on your own or you can apply for a family member, 99% of referrals come from case management. And it's always going to be a more streamlined, efficient process if you're able to get connected to blended case management first. You also cannot have pets in this environment and is completely voluntary, as are the other services we're talking about today. Next slide. And that's it. If you want to follow up on these services, you can contact Brandon Ben, who is the mental health housing coordinator for Chester County, and we'll be hearing from shortly. And I will also be uploading a one-pager to the event after probably sometime next week that will have Brandon's contact information as well as the contacts for the other services we've outlined today.